So for me, the resources I have used over the time have sort of changed. It's a bit of it's a steep learning curve. So obviously in the beginning, you don't really know where to start. I didn't find just Googling very helpful in the beginning at all, because it throws up all sorts of responses. Obviously you have your medical team for information, and the nurses that on the wards where you're being treated are a good source of information, and they know a lot. So I did used to speak to them, and obviously your CNS. Beyond that, I then started to look at charities like Blood Cancer UK, Macmillan, cancer research, and then places like No AML. As time went on, when I realised that these things are out there, but in the beginning you just don't know they're there. So it's all kind of a bit like networking, really. I use social media a lot. I would say as a resource, social media for me has been amazing, because, you know, speaking to other patients, so the peer-to-peer support has been really, really helpful. I mean, you have to filter it, so you have to be aware that there are some information or some people saying things that are just not helpful, but you do learn how to navigate through that. So really, I think there's a lot of different resources, and obviously everyone's different, and some people prefer different types of resources. But I think probably, I don't know, most, and it changes in time. So obviously you're going through your treatment phase. Your need, what you need is different to when you finish treatment. So things for me, because I live in a rural area as well, so I didn't have access to things like Maggie centres or big places like that. So I was a lot of social media and forums and things like that, going to events sometimes once I'd finished treatment, where you would see other people who'd been through treatment and you could talk to them and they'd tell you something you haven't already heard of. So I would say it's a mixture, really, for me anyway.